Hey guys, welcome to part two. Sorry for the switcheroonie. I had some microphone issues and they are better now. So, healthcare promotion and maintenance. The American College of Cardiology and the American Heart Association came up with guidelines back in 2013 to talk about lifestyle management to reduce cardiovascular risks. And what it did was it outlined the diet and exercise program that would be best to maintain a healthy lifestyle. And we talked about dietary patterns being similar to the DASH diet or the low sodium diet, limiting sugars, making sure that you're exercising 3 to 4 times a week, limiting alcohol intake, avoiding smoking and caffeine, maintaining a correct weight and BMI, and taking your medications as instructed. All of these are part of that guideline that was established. The DASH diet, the correct name for it is the Dietary Approaches to Stopping Hypertension. But in long story short, it's like a low sodium, heart healthy diet. That's just, you'll hear people say that they've been placed on a DASH diet, and that's what that would be. I hope that makes sense. So when you start with your assessment of a patient with hypertension, more than likely this hypertension is caught at a primary care office or when the patient has come in with another ailment or disease process. You know, a lot of times people come in with the flu, and when they take their blood pressure, they find out that it's elevated. Because most people with high blood pressure do not have signs and symptoms. That's the other reason that we need to make sure that we educate the patient on their blood pressure medications. Because a lot of times people go, well, you know, I quit having those headaches and stuff, so I didn't feel like I needed it anymore, or the blood pressure medicine they put me on made me feel dizzy. So it's very important when we're teaching our patients about their medications that we make sure that we let them know that you may not be having headaches anymore because your blood pressure is under control because you're taking your medication correctly. The other thing we want to make sure that we as the healthcare provider also is that we're taking the blood pressure correctly. Have we given the patient a chance to settle down, sit down in the room? Have they just ran in from the outside? Are we using the correct size cuff? If we're going to have them monitor their blood pressures at home, make sure that they get the right size cuff. And I always have them, especially if they are using an electronic cuff, I encourage them the next time they come back to the provider to bring their new, electronic cuff with them so you can compare it with the cuff used at the provider's office. So, an important thing to do with patients who have hypertension is to make sure that you're teaching about healthy lifestyle and the need to take their medication. Lifestyle changes are the cornerstone to successfully controlling hypertension. With lifestyle changes, a great deal of patients can be taken off of their medications. Now, if you look in your book, it talks about how doing lifestyle changes first, and then if that doesn't work, to be placed on medication. Now, with the lower blood pressure limits, most providers will treat the blood pressure with medication while the patient is working towards making some of those lifestyle changes. Eating that low salt diet, heart healthy diet is very important. Decreasing your weight if overweight or obese. Limiting your alcohol to 1 drink a day for women and 2 for men. That's like 1 jigger of spirits, 6 ounces of wine, 6 ounces of beer is considered 1 drink. Exercise is important. Patients with high blood pressure are encouraged to exercise 3 to 4 times a week for 40 minutes. They should work on stress reduction, whether it's meditation, or whether it's yoga, or decreasing some of the stressors in their life if that's possible. Other things that can decrease blood pressure is stopping smoking and using tobacco products. All of those are parts of the lifestyle changes that will help to reduce that hypertension. But if you look at some of those, they're very hard for a lot of people to change. You can't lose weight overnight. You have to build up to that, 3 to 4 days a week at 40 minutes for exercise. Smoking cessation can be very hard for the smoker who has been, smoking for 40 plus years. And so I think it's important that when we teach people about these lifestyle changes, I know my personal physician, he said, we're going to take on one at a time. Rome wasn't built in a day. We will take these on one at a time. We'll control it with medication while we're working on some of those lifestyle changes. And I think that's important to realize that if you just bombard a patient with a lot of these changes all at once, it's overwhelming and they're not going to do any of it. So I think you go back to the old wives' tale, how do you eat an elephant one bite at a time? You really have to slow down and take on these lifestyle challenges and changes, as a team, to work with this patient to improve their life and to decrease that blood pressure. Complementary and integrative health, such as use of garlic and CoQ10, have been controversial. And with that, you want to always make sure that you tell your patient to make sure that they inform their providers of any supplements they are taking, including the new onset of the use of essential oils. Make sure that they're telling people, their providers, what they're taking, and make sure that it's included on their health history. There is a very nice, very comprehensive table on page 725. It's chart 36-1. It talks about the reasons why different blood pressure medications are used and the nursing implications for them. I would find that to be very important. And if you're going, but Miss Redder, you're not going over every last word of it. I only have 30 more minutes to talk, and you guys have already passed pharmacology and are super smart. So you already know what medications will help with blood pressure. And so I have full faith in you that you'll be able to look at that chart on your own. One thing I do want to mention, she's mentioning it, is that diuretics are the first line of treatment when looking at use of controlling hypertension. Thiazides are low cost, highly effective. With loop diuretics, you have to watch out for that potassium, but they are very useful. Your calcium channel blockers are with vasodilation and decreasing the heart rate. ACE inhibitors block the angiotensin II, preventing vasoconstriction. And your ARBs blocks the angiotensin without inhibiting it. And then I have a couple slides here that just go over, again, basically what's in table 36-1 on page 725. This goes into more about talking about your thiazide diuretics. It's a first line for hypertension. It's low cost. Your ACE inhibitors, with these, you have to remember that you can get a frequent side effect is a cough. And as someone who was placed on this medication for her blood pressure, it's this annoying cough that just sounds like you're faking it. It was the reason that they took me off of the lisinopril and put me on a different medication, because it's this little cough that sounds like you're trying to get out of school. But it makes patients wonder why you're coughing. And now with COVID, I think, people would run from you. But anyway, that dry, hacky cough does happen with your ACE inhibitors. Again, all this information is here on this slide for you and on page 725. Your ARPs, you have to watch out for the hyperkalemia. They can cause dizziness, especially because they can cause low blood pressure with orthostatics when people stand up real rapidly. Again, we're talking about your beta blockers, calcium channel blockers. Now, I know I mentioned earlier that a lot of times high blood pressure is caught at a primary care provider's office because the patient is in with another problem. But sometimes the patient comes in to the emergency department or even their doctor's office with hypertensive crisis. And this is a severe elevation in blood pressure, and it's symptomatic. These patients have severe headaches. Their blood pressure is in the 180/120 or higher range. They're sometimes complaining of dizziness and blurred vision. They are short of breath. A lot of times they have a lot of anxiety. They can even have nosebleeds. This is a emergency, and it needs to be cared for quickly and in a hospital setting, because you're going to, of course, start an adapter. You're going to make sure that you have an open line in order to give medication through. And when you're giving they either administer beta blockers or cardine to get that blood pressure down quickly. A lot of times blood pressures are taken every 5 minutes in order to, because you want to bring the blood pressure down, but it's this fine line between bringing it down and bringing it down too quickly and having to work to get the blood pressure back up. So these patients are in a monitored bed. They are being cared for one-on-one or one-on-two so that blood pressure can be taken care of. And hopefully they can get that under control. Usually they can get it under control within a few hours, and then the physician and the pharmacist kind of calculate what it took to control their blood pressure and start to take them from the IV medications and change them over to PA meds to go home. But these patients are watched in the hospital for a day or two to make sure that their antihypertensives are going to work. Again, patient education is huge with these patients as well. I know I have talked a lot about the health promotion with hypertension, but it's so important. It is important to tell your patient to make sure that they're taking their blood pressure medicine every day, even if they don't have symptoms. And just because your blood pressure is back to normal doesn't mean you need to stop taking it. Tell them what the side effects can be and that there are alternative treatments if the blood pressure medicine that the provider has put them on causes these adverse effects that they don't care for, like the dry hacky cough or sexual dysfunction. Don't just stop taking the medication. Come back and talk to your provider to get on a medication that is safe. Make sure that they're following that low salt diet, that they are planning to work on their weight, that they're either planning on joining like a Weight Watchers or with following that low salt heart diet that will help with maintaining that better weight management. Make sure that they're looking at that alcohol restriction. They need to work on their stress management, and remember they're trying to get their exercise level up to 3 to 4 times a week for 40 minutes, and make sure that they are serious about stopping smoking. I know a lot of times, because some of these, even though some of these are quick and some of these are not. Weight management, if they're severely overweight, is going to take a while. They will sometimes give them medications to help with the stop smoking. But we can start limiting our salt intake and make dietary changes fairly easily, and that will help the patient to start to get that high blood pressure under control.